Hi, so I just wanted to explain a little bit about Invisalign and how it works. Myself, I've been practicing dentistry for over 30 years now, and I started doing Invisalign when it first came out. What I do find is that a lot of patients have lots of questions, and I'm trying to condense the most important parts of Invisalign so that if you're about to proceed to treatment, that you actually understand what Invisalign is, how it works, and what it can do for you. So the first thing about Invisalign is, yes, it's a clear plastic. It's actually processed so that it's lineated, and each part of the plastic has got a force or pressure in there, which is actually guarded and guided by computers. And it will push and pull your tooth so it goes into the right direction. When you first wear these Invisaligns, they will feel tight in your mouth. After about 2 or 3 days, they do loosen up, but they've still got force in there, so keep wearing them. Your dentist will tell you to either wear them up to 14 days, sometimes 12 days, sometimes 10 days, and sometimes 7 days. You need to follow their prescription. The next thing I wanted to say is that you do have to wear them all day long, and you only take them out when you eat something or drink something that's not water. Then brush your teeth. Brush your Invisaligns, and then put clean Invisaligns against clean teeth, and you wear them all day and all night. The other thing about Invisaligns is that it can cause a slight lisp. You probably might feel it more than other people hear it, but please don't worry about that, because any appliance in your mouth will cause a little bit of a change or a feeling of awkwardness for a little while, and after a while you just get used to it, and your tongue and your mouth will adapt, and when you speak you won't feel that you're lisping anymore, so that tends to go away. Now the Invisalign, how it works, it has a push and pull, we discussed that. The next thing is your dentist will either smooth the teeth in between, but we're talking very small amounts, less than a millimetre. We're talking 0.1, 0.2, 0.3, 0.5 of a millimetre. And we have special tools that help us measure these amounts and get things right for you. In the past, you've got to remember, a lot of orthodontists would extract teeth from the sides and then push the teeth into the right place. So Invisalign does it a little bit more safely, carefully, and a lot of orthodontists are now doing what we do, which is the smoothing of the teeth in between, and that's called IPR. The next thing that Invisalign does, the Invisalign appliance, I'm going to bring this closer to you to see if you can notice it has little bumps on the outside. There's one here, and there is a small one just here. Don't know if you can see it, but if you come to the surgery here, we can show it to you during a consultation period. Right, so these little bumpy bits, they'll be actually white in colour inside your mouth on top of the tooth. We add them, and they're called attachments. They help with the tooth movements, they help with seating of the Invisalign appliance in the right place. The teeth will move faster if you have them, and in the correct direction. A lot of aligner systems do not have that, and so they don't work as well as Invisalign. Invisalign, then, the other thing I wanted to tell you is about the cost. The cost of Invisalign can range from about £3,000 to about £5,000, so that depends on how severely crowded your teeth are and how much movements you will need. So if you can imagine the lower band where your teeth are not so crowded, you'll be paying less, and if your teeth are very crowded, you'll need more aligners, and so then it will cost you more. Each of these aligners are worn for 2 weeks roughly, as we discussed earlier, and then you change to the next one, and each one is numbered 1, 2, 3, 4, 5 and so on. When you get to the end, well, first of all, we say never throw away your Invisaligns. When you finish them, always wash them and dry them with cold water. You don't need to use any products, and put them back in the packets, in the right packet that's numbered 1, for example, or 2. So that when you get to the end, we will provide you with some retainers. Now some practices will charge you for your retainers, and they usually cost about £240 to £350, and that's for an upper and lower retainer. And some practices will have offers where you can get the retainers free of charge. The retainers are there to hold your teeth, but you've got to remember the retainers, although they're not as flexible as Invisaligns, this is quite flexible, they are more stiff and robust, but they will be made out of plastic, and there will be some small movements in your Invisaligns, in your retainers, sorry, which means that your teeth can move once you've had them straightened, but so minimally that you will not notice that. And with retainers, we advocate that you wear them for 2 to 4 months as soon as you finish Invisalign, so that the tooth movements can stabilise, the roots can stabilise, and then you can go on to wearing your retainers, in the night times only. And that's for a very long time, we're talking lifetime. I do find that a lot of my patients, after 1 year, their teeth become stable, and we advise them then they should just carry on wearing the retainers at night, maybe 2 or 3 nights in a week. And to be honest, by the time you've actually had Invisaligns in your mouth full time, you're quite used to wearing these things, and you're quite okay with wearing them at night time, especially if they keep your teeth looking straight and lovely. The last thing I'd like to say is that if you are clenching or grinding your teeth, let your dentist know. Sometimes the dentist can pick it up because they see wear marks or holes forming in your retainers or your Invisaligns. And in those cases, you will need to upgrade to either a CRA or SCI appliance, which are Bruxist appliance. They are made stronger, and they're for people that grind their teeth. They will hold your teeth and they will help with your grinding.